Colorectal cancer is one of the most common forms of cancer, with 550 new diagnoses per million per year. Around 350 will receive major surgery, 60 of which will be emergencies because the cancer has developed to the point where the tumor is obstructing the bowel. These cases are amongst the most difficult to manage. Due to the inability to prep the bowel preoperatively, patients will frequently undergo a Hartmann's procedure with an end colostomy. It will also not be possible to conduct a colonoscopy to exclude other potential tumor sites in the bowel. An alternative to a Hartmann's is the use of antegrade on-table lavage with primary anastomosis. This has contributed to avoiding colostomy formation in many cases. However, it does not facilitate a colonoscopy and is unpopular due to various problems associated with the procedure. Most commonly, antegrade on-table lavage is performed by introducing irrigation via a Foley catheter through the appendix and manipulating the bowel contents out through a length of anesthetic tubing attached distally. This can be slow, with frequent tubing blockages, leakage and contamination, and requires an additional enterotomy at the appendix. Operations can be extended for up to an hour, and the procedure is unpleasant for the surgeon and staff. Intermark has solved all these issues with the Retrowash by combining a new on-table lavage technique with a completely closed and sealed irrigation system. It also provides the capacity to conduct an on-table colonoscopy. The main device is secured to the distal colon, while the outlet tubing is secured to a detachable, sealable waste container. The key feature of the Retrowash is the capacity to use retrograde irrigation. The handpiece is connected to the colon with a sequence of ties, while a catheter is introduced distally, fed through an inlet port in the device handpiece, rather than via the appendix. The same port will also accommodate a colonoscope. The catheter has a high flow rate. Using 250 ml bursts, the irrigation breaks down and washes out the distal bowel contents first, before progressively advancing toward the cecum. It is much quicker than antegrade irrigation because there are no blockages. Less of the bowel needs mobilizing, and there is no second incision at the appendix. It is cleaner and safer because of secure attachment to the colon, the closed collection system, and because there is no irrigation introduced at the appendix. Once the bowel is clear, the colonoscope may be introduced, enabling the surgeon to check for synchronous neoplasms at the time of operation. Finally, the collection bag can be detached, resealed, and discarded. The Retrowash overcomes the problems long associated with emergencies and on-table lavage, allowing a real opportunity to maximize single-stage procedures, minimize colostomies, and visualize the entire colon at the time of surgery.